and welcome to another episode of Conversations with G&G. We're so excited to have a special guest with us today, and her passion is for supporting community health, and it's truly inspiring. Alongside her, we're also highlighting Community Care Chemist, Geelong's only not-for-profit pharmacy group, which has been dedicated to the wellbeing of local community for over 125 years. Emily Shears is a highly experienced pharmacist with a wealth of knowledge in both pharmacy and sports science, and today she'll be sharing with us some expert insights on medication management and wellness. Emily, we can't wait to dive in. Thanks so much for being with us today.
Thank you. It's really lovely to be here. I can't believe after 20 years of pharmacy that we actually get to have some proper PR about pharmacists. I think we're the most poorly marketed profession out there, to be honest.
Agree with you there.
So integral to, community wellbeing.
Yeah,
really.
It is integral to community wellbeing. Obviously, pharmacists are the most accessible healthcare practitioner, and as part of our poor PR is we still don't charge for that service.
Yeah.
So hopefully, with our discussion today, we get to elevate the profession and all that we do.
Wow.
Well, that's the aim.
Yeah.
Very good.
Yeah.
Exciting.
Awesome.
Yeah, absolutely. Now, medication management, such a good topic to talk about because obviously here we're aiming to assist carers. They could be formal, informal carers, and any of our listeners on tips and tricks. And I think having you here is a great thing for our listeners because medications can be confusing. People can take the wrong things. They might not know what devices or what assistance is out there that could help them manage their meds better. So perhaps we'll start with maybe our first question. What's a pharmacist's role in medication management?
Yeah, absolutely. Thanks, Giselle. I think firstly I'd just like to highlight what pharmacists actually do. I think there's a huge misconception that we're there just to stick stickers in boxes in a white coat on a step. We're actually highly trained professionals. So the minimum training is actually 5 years, so 4 years of university plus 12 months internship. And with that, we are medicines experts and advisors. So with that in mind, what you can find in a pharmacy is some really fantastic professional advice about medicines, and then further to your point in question about medication management. In terms of carers, whether they're formal or informal, so whether that's a family member or someone in a paid role, we know that medication misadventure or medication error is one of the biggest reasons that we see older adults in hospital. So medication management and stopping those errors before that happens is really integral to what a pharmacist does. As part of what that means, it can be reviewing your medicines. So if you're on lots of medicines, the technical term for that is polypharmacy. So if you do have lots and lots of medicines, quite often it's a great idea to talk to your pharmacist about having that reviewed. Any pharmacist can do that. If you are on more than 9 medications, you can actually be eligible for what's called an MMR or an HMR, which is just a really fancy term to have a credentialed pharmacist to review those medicines. So in terms of medication management, any pharmacist is qualified. I think that's really important to note that you can walk into any pharmacy. Pharmacies, not all of them are created equal. I think that's also important to note, and they're in terms of making patient service their focus. I think Community Care, who I've been a part of for the last almost 9 years, is definitely one of those pharmacies who does medication management really, really well with their genuine care.
And it's such an important thing because, as you mentioned, if we can manage those medications well, and that could include things that you buy over the counter, complementary medicines, it's important to have the pharmacist involvement.
Yeah,
with
absolutely.
those as well.
And I think it's not just mixing up your tablets, which does happen, but also knowing what might interact. So in pharmacy world, we'll call it drug-to-drug interaction, but there's also drug-food interaction, and then there's also drug and supplement interaction. So there's actually quite a bit of margin for error. So engaging in a pharmacist to be part of a care team is really, really important process. Even better if that pharmacist has a really solid place in your community or team care arrangement so that they're working well with any physicians that need to be part of your care as well.
And sometimes it's stuff you wouldn't even think about, isn't it? Especially when it comes to food. Oh, yeah, I'm taking my medicine. What's that got to do with what I eat?
Exactly. Supplements as well. There's many supplements which actually completely disrupt how an antidepressant might work, or even just
caffeine and iron's a really simple one, isn't it?
Dairy. There's so many things. There's even side effect considerations to other things that are happening within the physical being. So many things to take on board that hopefully a good pharmacist would be able to pick up and help you with and guide you with on what may be the best way forward with it.
Can we quickly talk about the home medicines review?
Yes.
Because some people might not know that it's available to them.
Yep.
So maybe can you talk about a little bit about what's involved, what actually happens in a home medicines review?
So home medicines review is, as I said before, is for those who are on 9 medications or more. And this is actually a process that you discuss with your GP. I'd like to think that most GPs would be aware of this. And what part of that process is usually to simplify medications or deprescribe, because sometimes we're on things for a really long time and then you actually forget why you're on them in the first place, which happens more often than not. Or if something's been prescribed and they haven't been scaled down when they were supposed to be a medication that is supposed to be reduced over time. So a GP would set it up. I'm hoping that GP would be working very closely with a community pharmacy, and then that community pharmacy would be then working with a credentialed pharmacist. So it's a whole chain of events, but it starts with a conversation either with your pharmacist, community pharmacist or GP, so that they can then set you up with the consultant or credentialed pharmacist who will come to you if it is safe and permitted for them to come to you at your home, which also allows for a bit of an occupational assessment as well. So when I worked at Colac Area Health as the outreach pharmacist, I loved going to people's homes because it was an opportunity to see what was in the fridge. You know, was it just margarine and a bottle of Coca-Cola, or was there, what else was going on for them in their life? And so by understanding that, it might have been not just a nutritional question, but where there's some rails to help them to go to the bathroom or to shower. And this all forms part of the report, which then goes back to the GP, so that, yes, you've done your medicines review, but there also might be eligible for other assistance, which I think is really important to understand as well. And also any person who's completed their HMR or MMR credentialing has also had cultural awareness training. So it is about accessibility for all. So it's also another important point is that we, as pharmacists, as any healthcare practitioners, we just want everyone to be able to have access to these services.
So you almost, as you mentioned before, occupational assessment. So almost stepping into the role of an occupational therapist, but without being one.
Yeah, definitely need to be cautious. Yeah, need to be cautious about staying in your lane.
Yeah, I'm curious to see, your perspective, because it's a great point that you raised.
Definitely not about making recommendations at that point, but it's the observations. So, and as part of team care planning, or what used to be the old EPC, so is part of team care planning, which again is able to be financially assisted by Medicare, is that your recommendation back to the general practitioner may assist this patient in having those services covered by Medicare. So if you identify that I think they might need some assistance with their nutrition support, then the GP is able to include a dietitian in that team care arrangement. And similarly, if you think that they are having mobility issues at home, they can be seen by an occupational therapist who is able to assist with having rails looked at or a ramp where there's steps and all that type of thing. So it's definitely not recommendations, it's rather observations of how this patient may be better supported.
Understood.
So it's another set of eyes.
Exactly. And I think, we have to acknowledge where we're at as a society in that there are many people living alone. I don't think that's ideal. I mean, you could do another whole podcast on loneliness, but I think acknowledging where society is at and how we can improve living for standards across the board for these people is really important. Medication management is an important piece of that puzzle, knowing that we are an older population and many people are on multiple medications as we age, and that's okay, but we've got to be able to look at how we can holistically support these people as well.
Yeah.
And some meds are tricky, right? Like inhalers, asthma
Yes.
inhalers.
Yep.
Sometimes they're so hard for patients to use and
Yep.
to make sure that they're effective in their treatment. So with that as an example, what are some other things that pharmacists could do to assist what's out there?
Sure. So I think one of the other things, apart from being medication and medicines expert, is that we do assist in learning how to use a device. So drug companies love to send us samples of how, totally placebo, so that we can practice how to use an inhaler or the turbohaler. And in terms of pharmacy finally progressing itself as a profession, we now have specialist diabetes pharmacists or diabetes educators, so they can then further assist patients with specific medication or mode of delivery with diabetes, especially for things that are needing to be injected. I think that's something that needs to be taught very carefully. Just handing over a pen once the script is filled and saying, have a great time with that is not the right way to go about it. Yeah. I think taking the time in a private space, in a pharmacy, like community care, it's really, we're so lucky that at the community care chemist we do have private consulting rooms to do that type of service. I know not every pharmacy has that type of service available, but certainly in community care there is the availability of the pharmacist to do that, and there's also the space to do it privately.
Yeah.
And devices is a really interesting one because, like, when you just even stop for a minute and you think about how many conditions require a device. I mean, you're looking at, we've already covered off, things like asthma and diabetes, but sleep apnea, when you're looking at blood pressure, EpiPens, it could go on and on, really.
Yeah, absolutely. And I think, again, just another string to the bow of the pharmacist. It's really important that the knowledge is out there that pharmacists can assist with that, and they're usually pretty happy to step out of the dispensary and do something else for 15 minutes.
And the scope of pharmacists, like now pharmacists can do vaccinations.
Yeah, which
Amazing.
is wonderful. And again, pharmacists as a collective need to work on their PR, but also, prescribing for ongoing medications. I think this is just wonderful that the scope has increased. Unfortunately, several representatives from the AMA aren't quite on board, but I think in terms of acknowledgement of us as a profession and our level of knowledge, it's really great to see that all these practices that we've been doing quietly for so long are actually being acknowledged.
And I think an important point with that too, especially with the prescribing stuff, I mean, it's the pharmacist essentially that checks in with all of that and does the dispensing. I mean, you think about how much pressure that takes off an already overloaded medical system, especially from a GP point of view, when you're just going in to get scripts.
Yeah.
Taking up appointment time, there's already a shortage. I mean, to me, it's a no-brainer.
Oh, absolutely. I think if you ask any pharmacist, they'll wholeheartedly agree. And I think also out of that has been the wonderful evolution of the GP pharmacist. It is great to see all these little specialties popping up and being acknowledged through proper channels, through fellowship and consultancy awarding, which is really nice as well. To have conference of those is wonderful. So the GP pharmacists, they do a wonderful job of in-house medication review, but also they assist greatly with that prescribing as well, and taking pressure off the healthcare system and GPs, who we know are overworked and also underpaid.
Absolutely. Because if you don't manage your medication well, what happens? You're going to have errors.
And you end up in hospital.
Hospitalizations, and the cycle goes on and on.
Yeah.
Question on Webster Pack. Can that be considered a device?
It's what we probably call a dose administration aid or a DAA.
Correct. Can you talk us through that? Because I know that it's quite popular within our own clients and whatnot.
Yeah, it's a really great way to have your medications organised week to week, especially when, again, back to that clinical word of polypharmacy. But it doesn't matter if you're not on lots of medications. If you just need assistance remembering to take something at 8 a.m. every day with your breakfast, I've checked plenty of packs that have one tablet in them, and I think that's really important is you don't have to be on 20 tablets to have this service. I think in terms of having something sitting next to where you make your cup of tea in the morning, which helps you with prompts, is really important. Again, back to the social isolation that we are unfortunately seeing, it's really helpful if you haven't got someone at home to assist you, then it's a really great point. In terms of setting it up, just go in and talk to a pharmacist. Obviously, highly recommend all the community care pharmacists across the Greater Geelong region. They all do it, and we also offer a home delivery service. So,
which I know it's free of cost.
Yeah, no charge, which is
incredible.
Huge.
That's a lot of time for you.
Yeah.
To pack them up and organised and deliver as well.
Yeah,
that's
so
such
we have specialist staff who do the packing. They've been trained in packing, and then a pharmacist checks each pack. So it goes through quite a stringent process, which is signed off by a pharmacist, and then the delivery service. So it's really a wonderful service. If you do have mobility issues, or if you're not driving anymore, or for whatever reason you might just have a broken ankle. It's a wonderful service there, and it helps organise everything. Obviously, there's things that can sit outside the pack. If you're on insulin for diabetes, we're obviously not packing insulin. So it's just the tablets that are safe to be in there. There are some medications that can't sit next to each other, and there's also some medications that can't be exposed to oxygen or air before you take them. So
there are some that can be.
Yeah.
But would you say that 80% of the medicines can fit within a Webster pack, right? The majority.
Just about.
And
which
you wouldn't
is
want
great.
the pessaries in there.
No, I wouldn't want the pessaries in there. No. Shouldn't laugh about that. I have had a patient who's asked why something wasn't working, and it was something that was supposed to be placed somewhere else. So there's many stories that, I could probably write a book on stories like that about pharmacy.
Was it the 7 hours? I remember the 7 hours.
PR, which was being taken orally. So, it's, a few things can't go in there, but on the whole, including supplements. So if someone is taking like Magmin, which is your magnesium supplement, that can go in there with it as well. And with that, it means not only do you get your medication set up for the week, but you'll have the pharmacy looking after your prescriptions as well. It won't negate the need to see a doctor. I must state that absolutely clearly. You will still need to see your doctor for review and for script writing. That process is not null and void by having a Webster pack, but it just means that there's probably better collaboration between your doctor, the pharmacist, and then the patient. So,
which ultimately will lead to less errors.
Hopefully, and the way the Webster process is set up with stringent checking, yes.
So you can even check the comparability of the drugs or the supplement together, right?
Yeah, so
on it sits in the same pocket, you can actually see with your eyes clearly if there's any.
Well, yes, and I mean, the way the programs are set up, they actually link into resources like eMIMS. So if there is issues, it is a flag for the pharmacist. So although, AI and robotics are a little bit scary to some for this instance, I think the way that we're able to automate these processes for the best outcome for the patient, it's actually a great step forward.
So we've spoken about Webster packs, but there's other dose administration aids that people might want to know about, I guess.
Yeah, there's the sachets, which is an automated process. A lot of nursing homes use those, so you probably wouldn't see a lot of those in the home. And then there's also aids that you can pack yourself. So you can buy a little tablet pack for a week and then have that, pack it at home if you're still feeling like you can be in charge of that process.
Or maybe if you go away for the weekend.
Exactly. Like you can even buy little 3-tablet ones, which are just for the weekend. So, there's lots of options that really aim to assist in compliance and reducing errors. So.
And you can also get, if some people find it really hard to pierce the blister in the Webster pack, There's a device for that too.
Yes. Yeah, these funny little pointers that just stab the back of the blister.
Yeah. So, I mean, I guess the important thing is see the pharmacist, right? Because
Yeah.
there's so many things available and you don't know what you don't know.
Yeah. I
So-
think the other thing is, again, could have been a pharmacy story I wrote in a book about people chasing tablets around a chopping board, trying to chop them in half.
Oh, yeah.
There's actually,
The
and they
tablet
cut their thumb.
Yeah.
They were
Oh,
in
no.
there because they'd cut their thumb, and then it came about that they almost cut their thumb off because they were trying to halve a tablet. There's actually devices that have a blade inside which you can safely, keeping fingers intact,
And it's so
halve a
easy
tablet.
to use. Like
Yeah,
I've
it's
got
like
one.
easy.
little
The
alligator.
finger and the tablet too, because it won't fall everywhere.
Yes.
But being careful with that too, because some tablets, you can't
Yes.
chop and have
Yeah,
because
that's
of the way
right.
they release. So
Yes. So there are. Yeah, we've got you can devices to help crush a tablet and also to cut a tablet. But I'm hoping that you have a conversation with your pharmacist first, and that they are well versed in the resource called "Don't Rush to Crush."
yeah.
If people aren't feeling like they're needing packing done, that's okay. You can actually still engage in the services of a pharmacist through script tracking and reordering. With the advent of ERXs or electronic scripts, it means that you can send your prescription through these software, send the prescription to the pharmacy ahead of time and have it dispensed, and then you'll get a notification saying when it's ready, or if there's issues, we have to order it. You can even be set up to prepay. So it's literally you walk in and collect.
Yeah.
So even with that process, again, the pharmacist still checks it. So if there's something that raises a flag, the pharmacist will still be able to talk to you. If there are issues, it might be as simple as saying, this is your last repeat, you need to go back to the doctor. But all of that is now through Meds Advisor as a script tracking service, which is just fantastic. Because I know, with the way we all live, some people don't have the time to hang out in a pharmacy to have a script done. Sometimes it's only 5 minutes, but if something has happened, then it can be a bit of a wait.
Yeah.
So it just helps with that process. If you know that you're not going to be in there shopping for lots of other things, you just need that script, I think it's a great service as well.
How many times have you been told, how long does it take to put a sticker on a box? How many times?
Too many times.
It's so much more complicated.
I know.
I think,
I think, again, that's the poor PR of the pharmacist is that we're not just sticking a sticker on a box. We're actually checking a lot of things, and I think even as a parent, it still grinds my gears when I hear people in a pharmacy saying, I just need the antibiotic really quickly because my child's sick. I said, as a parent, I understand that. But two, as a professional, they're actually checking the dosage against the weight, that it's appropriate, that it's not too much, that it's not too little, that it's the right antibiotic for what's happening.
Have they had it before?
Exactly. So
And doctors make mistakes. Like we've had that situation too where the wrong dosage has been accidentally
It's
typed in
possible.
and it would have been fatal. Like
yeah,
it's crazy.
Possible.
it is. So I think having that understanding, and then if you are in a hurry, sign up for Med Advisor. It's much easier.
Yeah.
The thing I've loved about e-scripts too, for my son's medication, is that he's got a condition that he needs to have, medication in advance, even 6 months at a time. So not having to worry about losing a physical script like with repeats on it. It's at the pharmacist, it's all held there, and you're running out and you get the notification and off you go, get some more. It's great.
And I think what also helps with that as a process for pharmacies, obviously they are a business. They do have their eye on their bottom line, is that for really expensive medications, if you keep the script there and you say, look, I'm going to need it in a couple of days' time, they'll order it in so it's ready for you. A lot of pharmacies, in terms of bricks and mortar, don't like to have on the shelf the really expensive stuff because things do go out of date. So with the electronic scripts and Med Advisor, it just gives everyone a bit of time to get that script ready for you, which is also a really important step. So then it stops, the frustrated customer who hasn't got what they need because it needed to be ordered.
And then especially things too, like if you're travelling, you're going to need medication for a few months at a time.
Yes.
To know that you can have that arranged as well.
Yeah, absolutely.
helpful.
Yeah.
Yeah, again, all of that is part of good medication management.
Yes, yeah, exactly. You know, it doesn't all have to be devices. It's helping anyone, whether they're on 1 or 20, you know. And it's part of, I guess, the remit of the pharmacy is QUM, or quality use of medicines, and making sure that what someone is taking is being effective for them at the lowest dose possible.
And we are high consumers of meds in Australia, aren't we?
Yes.
I think I was reading like 40% of people over 50 years of age take 5 or more meds already.
Oh, that's a big statistic, isn't it?
Yeah.
You have to check people and see if they're rattling.
But it's another reason why I have the good quality conversation with the pharmacist about
and things
the
you may not
medications.
need anymore too. Like if you've got a
Exactly.
condition that you can maybe be reversed, like type 2 diabetes, you may need some assistance with medication for a shorter amount of time that, you know, on review you can get off it and not have to worry.
I think that's a good point, particularly like people that have gone into hospital and then have been discharged, go home, they might go on particular medications that might need to be reviewed down the track. It's not something that they would need to be on
And I
all
think
the time.
it's important to note there, just back a step, that transitions of care is our biggest time for error. So going into hospital and medication history not being done correctly and then discharge from hospital, again, is our biggest time for error. So it's really important to insert a pharmacy at those 2 contact points. But yes, in terms of deprescribing, which is huge, I think it's really important, especially after hearing that statistic about how many people are taking medications.
I hope it's right. Check it. Fact check. No, but I'm pretty sure it was high. I was quite staggered.
Yeah, I think deprescribing is really important, and I think it actually lends into a lot of the work that I do when we apply an exercise sports science lens. As part of team care arrangements, where we see, often for the first time in a long time, older adults being referred to do exercise with an exercise physiologist or exercise scientist as part of their TCA. Things need to change once they start exercising because metabolically things start to shift.
Yeah.
So having that conversation with your pharmacist about how you're feeling ongoing is really important because the whole reason that someone has probably been referred to exercise is probably due to chronic disease management when we're talking this demographic. You know, so there's probably some wellbeing goals that need to be shared with your pharmacist. Like if you've started exercise to lose weight and lower your blood pressure, please let your pharmacist know, because what that might mean is that you start to experience side effects because your medication is actually working too well.
Yeah.
So you might be getting dizziness because of your blood pressure medication now working way too well, which means you can step back on your blood pressure medication. So it's really important that if you do have referral to start exercise, or if you're starting, you know, you've done your 0 to what's the couch to 5K and now you've got your sights set on something bigger, but you're taking medications, whether it's for another chronic disease, please include a pharmacist in that conversation, because quite often as things shift metabolically, we need to change what is happening with our medication, because there is pathophysiology and pharmacology that does shift with that.
So we treat the patient, not necessarily always the number.
Yes,
Right.
that's
We look at
right.
it holistically.
Yeah, so that's just really important, I think, to understand that it's so wonderful we have these services, but we also need to collaborate and understand how that affects the patient, if you know, and ultimately we want to get to a place of deprescribing anyway. We don't want to have heaps of medications. So reducing that, whether it is out of a transition of care or change in life circumstance.
Have you got any funny story? Like, well, you already said one. Have you got anything, have you come across many patients that are on, because obviously there's lots of different brands, right? And that can be confusing.
Yes.
There's generic brands. There's
I do love it when they come in and say, I'll just have the genetic brand. I've got a couple of funny stories. I think one of the funniest ones, which is probably just an in pharmacy joke, where I had a nurse who, and I didn't know she was a nurse at the time, came in with her script. It was for metronidazole, which has a huge amount of side effects, some of them quite unwanted, including tasting like metal. You've eaten a metal pole in your mouth. Anyway, I was doing the right thing and going to speak to this patient and said, you're taking metronidazole, you can't have alcohol. These are also some of the other side effects. And she unfortunately said, oh, it's okay, I'm a nurse. And I looked her dead in the eye and said, no, nurses get side effects too. I wasn't very popular after that comment, but it's fair to say it was probably 10 to 6. We were probably closing at 6 p.m. I'd been there since 8 a.m. This is back when I owned a couple of pharmacies, and I just thought, it's just another experience where we're so devalued, you know, and I think I was at the end of my tether with that one. So,
and it's still your responsibility to share that information.
Exactly.
Even if they do say, yep, I do know it, it's always good to check in. You might learn something as well, right?
Yeah, I think one of the other funny ones, apart from the person who was taking rectal medication orally, there was also an instance, again, when I was a pharmacy owner, and one of the other pharmacists had apparently shown this person how to use their inhaler, but they weren't using a placebo device. They were using the device that had been dispensed. And the pharmacist, trying to do the right thing, didn't place the inhaler in their mouth, was puffing it over their shoulder. And so they came in to say, I just wanted to just check with my inhaler. It doesn't seem to be working. And I said, all right, show me how you're using it. And so they shook it, did all the right things, and then they puffed it over their shoulder instead of creating a perfect seal over their mouth. So it's just lots of funny little things which you try not to laugh at the time.
Yeah.
But it just goes to show how important these conversations are and getting it right.
Yeah.
Because, medication management is so many things.
Yeah, it really is, isn't it?
Yeah.
Oh, that's quite funny.
Yeah, 20 years of pharmacy.
That's it.
And all the things of, I coughed this up this morning, like, what can I do for it? I think, oh, my gosh, would you go and show that to a GP? No, you know.
Pharmacists see a lot.
Yeah, put that back in the tissue and in the bin, thanks.
Yeah. You know, we're so accessible, and we're on in the community, usually the first.
Yeah, we're absolute frontline.
Do you ever pick up errors from GPs, doctors?
Yeah, I have a few. And
happen.
I think on the whole, GPs are really responsive, or any physician when you call them and say, look, I just need to clarify. And I think it really comes down to that professionalism of an individual pharmacist to understand that, you know, no one likes to be pointed out that they've made a mistake. And I think in anything, if you take a punitive approach, it's not going to go down well. So having a conversation to say, and really open-ended, to say, hi, just wanted to check what we're treating here, what are the outcomes or what are the desired goals, because it might be an off-label prescribing that I've not read about.
Yeah.
So I might learn from the experience too, or the other result may be that they learn as something in return that perhaps the dose wasn't right for this indication and this patient. So I think that as a profession, yes, we do pick up errors, but in the way that we work with our professional colleagues sometimes needs a bit of work. And certainly in my previous life as a pharmacy owner, I was very careful about how my staff approached an error. I just think, you need to ask the question rather than going and accusing first. There's a lot to learn.
It's an error necessarily, right?
Yeah, it may not be an error, but yes, errors do happen.
But I see what you're
that
saying.
prescriber may have also been to a conference somewhere and learnt something, you know, that I hadn't been brought up to speed yet.
Yeah.
It's really, you know, too, when you're talking about patient care, I guess the goal is to be a team, isn't it? It's to have each other's backs. It's to have the best outcome for the patient.
Part of the holistic care for the patient, for the best outcome.
Yeah, and I think as a profession you need to be continually learning as well. So always looking for the desired result for the patient and that outcome, but also keeping up to speed with all your learning and learning from your colleagues as well.
Yeah.
So good.
So just, I guess, on that and best outcomes, what do you think it is that sets community care chemists apart from other pharmacies?
I think there's a couple of things. The biggest thing is that it knows the Geelong community and the greater Geelong region. It's been such an integral part of this region for so long. And the fact that it has stayed and remains absolutely service focused for our patients. It's one of the reasons I'm still there, to be honest. And I've worked for other chains and you just start to feel like a number. I think being able to practice in a way where you are encouraged to spend the time with the patient is really great as well, because there's plenty of other pharmacies where the pharmacist stays up the back, stickers on the box, and it just becomes a robot. To me, that's not That's not care. Care is going and speaking to a patient and spending the time with them to check that everything else is okay. They might be collecting an antibiotic script, but is there any other things that they may need that day? And I think that's really important, and community care absolutely still does that. The fact that they offer free home delivery as well, to me, says just how much they want that service to continue through the community.
Yeah.
So.
Wow. Well, what a wealth of information. That's been so helpful. So many topics covered, and just off the bat, you really know your stuff.
Yeah,
well
absolutely.
done.
It was
Yeah.
so good. Yeah.
Okay.
Thank you for coming. And
That's
joining
all
us.
right.
Any last tips or anything else that
No,
is
just
important to share?
just don't be afraid to come and chat to a pharmacist. I think, or me personally as a pharmacist, love to get away from the dispensary. Always up for a chat. I don't know if you can tell. So I think go and just tap into that knowledge. I think pharmacists, because of the way the profession has gone over the last 10 years, there's obviously been some pretty key things have happened government-wise, price disclosure, other pharmacies teaming up with major pharmaceutical brands. We've been squeezed into somewhere where we perhaps don't want to be. And I think pharmacists underestimate their scope and their level of knowledge. So go and ask a pharmacist about your medication. They've probably got a lot to talk to you about.
Yep. Wonderful. Thank you so much, fellow pharmacists. Great to finally have a pharmacist. We might have to get another one on, or you come back.
Okay.
There's probably so much more we could talk about.
Oh, you could do a whole episode on crazy stories.
Crazy stories. That could be an idea.
It could be.
Oh, my gosh.
Just one for a bit of a laugh.
Oh, yeah. Some of the stuff I've seen, heard.
Yeah.
Yep.
It happens,
Yep.
but it's okay. We get through it, don't we? Thank you so much.
That's all right. It's been great.
Thanks for tuning in to this episode of Conversations with G&G. We hope today's chat offered some fresh insight and support for your caregiving journey.
If you're looking for more tools, strategies, or just a bit of encouragement, head over to our website. You'll find resources to guide you every step of the way.
Whether you've just started out as a caregiver or you've been caring for a loved one for years, there's something there for you.
Don't forget to subscribe, share this episode with someone who needs it, and join us next month for another real, honest conversation.